Oh, hello there. Today we are going to talk about Arrestin and how it is linked to periodontal treatment. But first, let's review what are antibiotics. Antibiotics are medications that destroy or slow down the growth of bacteria. There are three major routes for antibiotics: oral route, injection, and intravenous routes. What is Arrestin, you ask? It belongs to the tetracycline class of antibiotics and is delivered directly and locally to a periodontal pocket. Fun fact: unlike antibiotic pills you swallow, Arrestin is locally applied, delivering the antibiotic right where you need it at the site of the periodontal infection. Arresting and scaling root planing fights harmful bacteria that scaling alone can leave behind. Advances in periodontology and Arrestin. Arrestin is a leading locally administered antibiotic to treat chronic periodontitis. It is a controlled release mechanism that delivers the antibiotic minocycline hydrochloride in a powdered microsphere form, which is a bacteriostatic broad-spectrum semisynthetic tetracycline derivative. The mechanism in use is today: a cannula tip is used to expel the microspheres into the pocket where it binds to the tooth surface because of the sticky nature of the carrier material. Over 5 to 7 days, the powdered microspheres dissolve, releasing the embedded minocycline. Measuring gum pockets. Let's take a look at a video. Left untreated, gum disease can create pockets of space that loosen teeth. Using a probe, we would measure gum pockets. 4 millimeters would be a warning. 5 to 6 millimeters would be act now. And then anything deeper, we would probably use Arrestin. Scaling and root planing is a treatment to help fight gum disease. Pockets can deepen and bacteria may spread. If we take a scaler and drag it over the teeth in this video, let's get some of that bacteria off the teeth, subgingivally and supragingivally. Let's try our best. But there might be something left behind. Finding hidden bacteria. Scaling and root planing is effective but has some limitations. Using this microscope, we can look at those deep pockets, and there is bacteria left behind. Harmful bacteria can remain hidden to the naked eye. Dental instruments can't always reach the base of the deeper pockets, but Arrestin can, from 5 to 9 millimeters. Dosage and administration. Cartridges 1 milligram, does not require local anesthesia. Insert unit dose cartridge to the base of the periodontal pocket and press thumb ring in the handle mechanism to expel powder while gradually withdrawing the tip from the pocket base. Handle mechanism should be sterilized between patients. Arrestin does not have to be removed as it is bioresorbable, nor is an adhesive or dressing required. So here's a video of how Arrestin would be applied. We would put the Arrestin tip into the pocket where the scaler can't reach. And dispense it. It's a fine powder that gets into the base of the pocket to fight the bacteria. There's the Arrestin working its magic. So when is Arrestin indicated? Arrestin is indicated adjunct to scaling and root planing for the reduction of pocket depth. It is a site-specific adjunctive therapy prescription medication applied in dental offices for localized periodontal pockets that are non-responsive after thorough surgical and non-surgical periodontal therapy, sites with disease recurrences, and is beneficial for patients who are not good candidates for surgical therapies, medically compromised, smokers, and those with inadequate plaque control. Here's a graph to show that Arrestin with scaling and root planing reduce pocket depths more effectively than scaling and root planing alone, even those in the most susceptible patients like those with cardiovascular disease, smokers, and those over 50. Cool, right? What are some advantages, you ask? Well, when used along with periodontal instrumentation, it improves cal and allows probing depth reduction of 0.5 to 2 millimeters compared to conventional periodontal instrumentation. It is easy to use and nothing to dislodge from the pocket after. Single-dose cartridges, no pre-measuring, and no pre-mixing required. Targets bacteria where instruments can't reach. Any adverse reactions? Oh yes, headache, might have infection, flu syndrome, pain, oral candidiasis. Allergic response may result in the development of resistant bacteria because of the use of antibiotic preparations. Some contraindications that could occur. Caution: patients who are hypersensitive to any minocycline or tetracyclines, pregnant or nursing women may cause permanent discoloration in the infant teeth. Children, the safety and effectiveness of the Arrestin has not been established in immunocompromised patients or those with coexistent oral candidiasis or a predisposition to the same. Post-op manufacturer instructions. Chewing gum, chips. Oh no eating or drinking for 30 minutes after. Avoid touching the treated areas for 7 days. Wait 12 hours after your treatment before brushing teeth. Wait 10 days before interproximal plaque removal in home care. Avoid foods for 1 week that could hurt your gums like popcorn or chips, and don't chew gum or eat sticky foods. Some interesting information about Arrestin. When incorporated into a routine oral maintenance program along with scaling and root planing, Arrestin targeted periodontal bacteria to fight infection at 1 month, provided significantly greater pocket depth reduction for up to 3 months versus scaling and root planing alone, and resulted in reduced pocket depth after 1 month and maintained at 9 months. Here's periodontitis for you. So let's start targeting bacteria, send in the spheres. Arrestin. What is the future direction? How exciting. Arrestin therapy is inspiring other intraoral therapies in the fight against periodontitis. The most widely tested system, monolithic tetracycline containing fibers, has shown significant clinical benefits when used alone as compared to no subgingival therapy. Similarly, controlled trials involving chlorhexidine strips used subgingivally every 3 months in the place of routine supportive periodontal therapy have been showed significant clinical benefits for up to 2 years. That's awesome, guys. All right, we have some references to show ya. Thank you so much. We learned about what Arrestin is and how cool it is. And of course, we learned how Arrestin is linked to periodontal treatment. Thanks for your attention and have a brilliant day.